Hello, everyone, and welcome to our webinar, Safety First, Slips, Trips, and Falls Prevention. My name is Lauren King, and I am the Provider and Community Relations Liaison at Coastal Hospice. Welcome to our Caregiver Academy. We are excited that you are joining us today. We have colleagues from Tidal Health, Anchorage Healthcare Center, Autumn Lake at Mallard Bay, Alice B. Tall's Nursing Home, and many, many more. Thank you for being here today. Before we begin, allow me to go over a few housekeeping items. You may see myself or my colleague, Alejandra, pop up in the chat box to address or help with any technical issues. We want to thank you in advance for your patience should we have any. I'll also discuss the program evaluation at the end of this webinar. Please use the chat feature to ask questions and communicate throughout the webinar. Further instructions are located in the chat box. Our webinar today will be moderated by Lauren Blair, Provider and Community Relations Manager, and we have invited two experts on staying safe in the home here with us today. Lauren has more than 15 years of experience in the healthcare field. She is licensed in the state of Maryland as a licensed master social worker, licensed in Delaware as a licensed clinical social worker, and is on the board of directors at the Gray Center of Maternal and Women's Health. Lauren, I'll hand it off to you.
Thank you, Lauren, for that introduction. I'm so thrilled to be here today and to have Robbie Chin and Nicole Moore with me. I'm going to go ahead and just give you guys a little bit more information about our lovely panelists today. Robbie Chin graduated from Salisbury University in 2001 and has been the Health and Wellness Coordinator, Trainer, and Group Exercise Instructor at MAC Inc. for 8 years. He's a certified personal trainer, Westside Barbell Certified Coach, Senior Strength and Conditioning Specialist, Barefoot Balance Specialist, and a Certified Parkinson's Wellness Recovery Instructor. Robbie has extensive experience training with geriatrics, special populations, and caregivers to improve and maintain their functionality and quality of life. Robbie says, it's imperative to learn how to move pain-free and powerfully. Our lives depend on it. Thank you for being here, Robbie.
Thanks for having me, Lauren.
And our own Nicole Moore. Nicole has worked for over 25 years as a registered nurse, earning her bachelor's degree in nursing from Penn State University in 1996. It was during this time she discovered her love of working with our aging population. She completed independent studies in geriatrics, as well as certified dementia practitioner training, and has focused in this area throughout her career. She joined Coastal Hospice 7 years ago as program coordinator for the Medicare Care Choices pilot program. Nicole has spent the last 5 years as team leader for the Lighthouse Home Care Team, which serves the greater Salisbury area. Thank you, Nicole, for being here with us.
Thank you so much for having me.
Again, just want to welcome our panelists and to all of the attendees today. Thank you for being here with us. We're so happy to have you. Robbie, will you tell us a little bit more about what MAC Inc. does?
Sure, absolutely. And thanks again for having me. I'm really honored to be a part of this, and appreciate all the time and effort and organizational stuff that Coastal Hospice have done to put this together. And also wanted to thank everybody for their time and for tuning in. So hopefully we can be of some assistance today. So at the MAC Center, we're located in Salisbury, Maryland. MAC stands for Maintaining Active Citizens. So we're actually a state-run nonprofit. I help manage and do personal training, group exercise stuff. I help manage their wellness center, which basically it's the gym facility for folks that are 50 and older and anyone with a disability. But MAC has a variety of different services and departments as well. So a lot of folks don't even know we're here, but we offer a variety of services for seniors. So everything from like Meals on Wheels. There's actually a senior day center program where folks can come spend the morning and part of the afternoon with us. They can get breakfast, get fed lunch. We also have an Alzheimer's and dementia wing. So some of those folks that are a little more functional, still engaged safely in the community, so they can come here several days a week, give their caregivers a break. We also have Veterans Affairs, even like recently. So I had a gym member who was like really active, but then suffered a stroke. And so they were going back and forth between different home health and at home care, and she needed some home health care that needed to be able to like provide someone that was certified to do like feeding tubes and things like that, and they were having a hard time during that transition phase. So MAC was actually instrumental in helping to connect them with resources. So now they have round the clock care. So there's a lot of other programs and services that we offer. If you're interested or curious to learn more, if you check out our website, it's macinc.org. Lauren, thanks.
Wonderful. Thank you so much, Robbie. It sounds like there's so many wonderful services over there for the community. Thank you. Nicole, how about Coastal Hospice? Will you tell us more about that?
Absolutely. So Coastal Hospice was founded in 1980. We currently serve the 4 lower counties in Maryland. So that's Somerset County, Worcester, Wacomico County, and Dorchester. And we see patients in their homes, whether that would be a traditional home or nursing home assisted living facility. In addition to that, our interdisciplinary team, we have 2 inpatient facilities. We have Coastal Hospice at the Lake, which is a wing that is leased at Deer's Head Center. That unit is utilized for more intense symptom management for our patients in the event we can't get symptoms under control in the home. So it's intended for a short-term stay, sort of for some fine tuning and symptom management, in addition to providing respite services for our patients so caregivers can get a little break in the home when needed. We also have the Mackie and Pam Stanzel House down in Ocean Pines, and that is our hospice house that extends an environment for more safe caregiving to patients that may not have all the resources in their home to take care of themselves efficiently and safely. We also have our palliative care team that is for symptom management of chronic illness, and that is separate than hospice. And then we have our Compass program, which is a free non-medical program, and I'll get more into that later on in the program.
Wonderful. Thank you so much, Nicole. Again, wonderful services we have right here on the shore. That's wonderful. Thank you both. So what should we expect to discuss today? Robbie, let's start with you.
Sure. So we laid out several objectives for us. So big key takeaways that we want to get from our session together today. So number 1 is promote safety and awareness. So we'll break down that a little bit farther. And number 2, this is obviously for patients and caregivers. So minimize the risk of injury and maximize longevity. So whether you're a new CNA, like we recognize that some folks are like 20 years old, and there are some folks that are like in their 50s, 60s, maybe even 70s that are still asked to do the same tasks as, say, the 20-year-old. So we want to make sure that not just the caregivers, but also the patients, we can minimize their risk of injuries and falls and increase their longevity as well. And Nicole?
We're also going to demonstrate, or should I say Robbie's going to demonstrate how to move properly, powerfully, and pain-free. And we want to promote communication and connection between a caregiver and patient through some of this. One of the things we look at as increased fall risks after multiple falls, and a lot of times that's related to patient fear of another fall, and then following any injury, if there's any deconditioning or weakness, musculoskeletal, that certainly increases the risk of recurrent falls. We do reevaluate risks with each fall and try to create a comprehensive plan of care to continue to make efforts to prevent recurrent falls.
Great, wonderful. Thank you both. I'm looking forward to hearing more. Robbie, will you tell us about these fall and injury statistics that we see here?
Sure. So I think it's fairly common knowledge that, you know, as we mature, I don't like saying age or old, as we mature, our fear and risk of falling increases, but like how real is that? So according to the CDC, folks that are 65 and older, usually a quarter of them experience a fall each year. right? So out of that quarter, so the people that have experienced a fall, you're now twice as likely to experience another fall. And like Nicole said, some of that could be due to fear of falling again. It could also be due to deconditioning or a variety of factors as well. And then out of those falls, it's like 1 in 5 actually tends to be a significant fall that either leads to like a hospitalization or some sort of significant injury. So either a dislocation, a sprain, broken bones, head trauma, things like that. So it's important to know, like, yes, we are at risk, and especially as we mature. And then out of those falls, so usually like if it entails a hip replacement, that is like huge fear. That's something we see as I'm, trained and managed the wellness center at MAC, working with the 50 and older population. A lot of falls generally do come with like hip injuries, but 95% of hip replacements are due because of a fall. So with some of the things that we mentioned today can help us minimize our risk for some of those things and can keep us going.
Well, those statistics are startling. We want to make sure for sure that we're keeping people safe in their homes. So I understand once a person falls, they have, they're more likely to fall again. Nicole, what do you think is the reason for that? What do you think increases that risk?
Well, as discussed before, a lot of times just that fear of falling and having physical injuries that they're recovering from, and they are weakened or a gait imbalance, that type of thing. And due to the nature of our job, it's also we see an increased rate in injuries and back injuries related to a lot of the activities we perform with transfers and assistance with activities of daily living. As part of our fall risk assessment and review, we also do track and trend different components such as time of day and what were the activities that the patient may have been doing at the time of the fall. I know some highlights. We've noticed that the majority of our falls occur in the bedroom, which really is in reflection not super surprising, considering we often are caring for people at end of life, and so they do become bedbound at some point in their disease process and journey. Also, I think the other one activity that is the activity at time of fall is something we notice that usually it is the patient trying to attempt ambulation. So we do just take a look at all the components revolving around the fall that takes place to try and come up with interventions to prevent recurrence.
That's very interesting. I wouldn't have thought about, the fear of falling causing more falls, but certainly if you're scared to, you're worried about ambulating, that fear is going to remain in your mind, I'm sure. So that's very interesting. Thank you for sharing. Robbie, will you tell us about the Bureau of Labor Statistics?
Yeah, so this was really interesting to me. I actually didn't know this until Coastal Hospice invited me to be a panelist. So after doing some research, I found out, so folks that are in a caregiving position or as a profession, as a CNA, y'all are significantly more likely to experience an injury compared to like construction workers and police officers. It is very statistically significant. I think they said out of like 10,000 workers or so, that was like the average pool that they pulled from. So the important thing to know is like, all right, as we take care of others, we have to be very aware of how we move, how we take care of our bodies, how we take care of ourselves to continue to take care of other people because we're at a higher risk of injury. And most of those injuries happen to the spine or lower back, shoulders, like pulling or trying to help move someone. But a lot of that, for the sake of today's discussion, will be like spinal related injuries. So hopefully we can equip you with some strategies to help keep your body moving. And it's nice. I love training people in a gym where like all exercise, they're like nice and symmetrical. These force vectors are coming at you in a very anticipated, neat direction, but taking care of someone it couldn't be farther Everything is asymmetrical forces that are acting upon your body, pulling you out of position and out of balance. So my job here today is hopefully equip you with some strategies so that you can keep delivering care effectively and safely for as long as you need to.
Wonderful. Thank you so much.
Thanks, Lauren.
From my understanding, there are 4 general types of falls. Robbie, could you tell us a little more about that?
Sure. So again, working at the Max Center, training with mature adults, this is something we see a lot. So to kind of help break this elusive thing of falls and stuff, if we can break it down to things that we can identify throughout our daily lives, it becomes easier for us to manage and prevent. So 4 that we want to keep in mind, and this came from occupational health and safety. So they did a pretty good job grouping them. So STEP is our first one. If you want to think of STEP in terms of like, it's a step down from something. It's like an unanticipated like change in level. So it could be something like stepping down from a curb or at home. I know with like hospice care, a lot of it is like we're at home. Some of that can be like changes in a room where there's like just like a small little false step. So just keep in mind a step would be, step falls are just descending, unanticipated change in elevation. Right. Slip refers to more like textural contrast. So like obviously loss of friction, like wearing socks on hard floor, even just moisture or water on a like smooth, slippery surface. Also, I've experienced a slip fall here at the Max Center. We had a lady that was going from class to class. The halls were like beautifully waxed. And the aim for that was to create a little bit more like traction and friction so that people can walk safely. While her foot didn't take a proper heel-toe step, she kind of shuffled a step. It grabbed the floor. It wouldn't let go of her. Forward momentum, head went right into a door. So slip can also mean the opposite. Besides just like slip and fall, it can be like, oh, my foot got stuck and fell. So we have step down, slip, trip, and stump kind of seem similar. But if we think of trip in terms of like an object that got in the way, something like say like the edge of a rug, an extension cord, a toy, kids' toy, dogs' toys, things like that. Something that could potentially move that's just in our way that we're not anticipating. And a stump, if you want to think of, again, something that got in our way, but it's a little bit more like immovable. So it could be like coffee table, corner of the couch. It could even be like transition of floors, how they might have like a little like rounded seam or something like that to go from like, it could even be like a transition from hardwood floor to carpet, and there's like a little rim there, so stump. So if we try and keep those things in mind, like as we go and like walk and live our lives, we can kind of identify and then mitigate some of those things. And Nicole, I think in our practice, we identified like potentially a fit.
Another scenario we often see in our caregiving settings is a loss of balance or a good grip during a transfer. So between the patient, possibly, weakness in the lower extremities, and they just sort of go down when they're normally able to do a guided transfer with assistance, or a caregiver that sort of loses grip. That's why assessing an environment and slowing down prior to a transfer or providing care is so important, so we can identify any potential hazards, or to make sure we have the proper assistive devices in place for safe transfers, be it a gait belt or a Hoyer lift, those types of things.
Great to know. Yes, all about those different types of falls and things that we could help ourselves with. Perfect. Thank you. Thank you both. How about environmental variables and how we can manage that proactively? Robbie, I'm excited to hear more about your Stepping On program.
Sure. So when we talk about different like fall risks, and this will be more so related to the home. Max Center has a program called Stepping On. It's an evidence-based program. We partnered up with University of Maryland Eastern Shore's Physical Therapy Department. with their students, and Dr. Klima kind of helped us launch this program and develop it. So the Stepping On program is free. It's 7 weeks. You only meet like once a week for about an hour, hour and a half each week. It kind of focuses on something a little different. They also have specialists that come in. So they have a physical therapist come in and they talk about some different exercises that folks can do to help basically kind of maintain their bodies. So like, just like how we have to maintain our vehicles, we have to do certain things like constantly to maintain our bodies. They have a pharmacist come so they can talk about the effects of medications and our risk of falling. They have an optometrist come and they talk about how vision can impair or increase our risk of falling, even like the fact of having bifocals can change one's like depth perception, things like that. So they've got a couple other sessions, but it also talks about good management strategies that you can employ like immediately in the home, and kind of segueing into some of those strategies. They talk about some different like simple, very cost-effective preventative products that you can install in your home that I'm sure we've all like maybe thought about, but didn't realize like how cheap and how effective they are, and actually how easy they are to get them installed in the home. So I did a little bit of research. They talk more about this in the Stepping On program, which if you're interested, again, check out the MAC website. You can always call the MAC Center and inquire about the Stepping On program. But some good products that they go over, and ones that I've found as well, would be grab bars. So with these products, I'm not like sponsored by any of these companies or anything. I just did some independent research, tried to find some good options for everyone. So grab bars, actually found on Amazon. There's a company called Vive, V-I-V-E. I think they have grab bars for as little as like $20. And I know it's be really nice to have those like in our bathroom or in different places that we need them, but we're like, I don't know how the heck to install that. One of my physical therapist friends actually did a little bit of research for us, and she found that there's a place called the All Mobility Store. Again, that's A-L-L, All Mobility Store. They're in Delmar. I have their number. If folks are curious, we can make sure you get that contact information, and they'll come and help install that as well. So having adequate lighting. So there are even like night lights that are like light censored, so you don't even have to worry about like turning them on. When it gets dark, it'll turn on its own. I found some non-slip, I guess it's called like non-slip rugs. It's like this like kind of rubber, semi-textured mat that would go underneath the carpet, or say an oriental rug or something like that, to give it like a stick, give you a nice even flat surface. So I actually found one at Walmart it's a 20-inch by 68-inch roll, so you can cut it to whatever dimensions you need. Y'all, that's $7. It doesn't, so that's like having one for free. It doesn't get any better than that. And there are also like non-slip treads that you can put like on the bottom of a shower or a bathtub, or even like on, like I say, like the edge of a stair. And even some of those are actually like will glow in the dark, so people can see the end of the stairs and provide some texture. So I found some of those actually at Home Depot, like a pack of them for, again, as little as like $5 or $7. And then the other thing too, as caregivers, whether it's like your family or if you're a CNA going into someone else's home, another good thing to chat about or to plan around, so to speak, is how we position the furniture in those high-risk areas of falls, like Nicole said, like the bedroom or in the living room or bathroom. So just making sure like, hey, we can space some stuff out, so it's like ample, what we call it, circulation space around it, so that the patient and the caregiver can get around fairly easily and stuff too.
That's great information. Thank you, Robbie. And the Stepping On program, does it have a cost to it?
No, it is free. And then it usually has like snacks and stuff like that.
Oh, yeah.
It's
Even
wonderful.
better.
Yeah.
That's great.
It's free as well. So I know I talked to Dr. Klima, and they said if there's enough interest from this webinar, we can definitely organize a stepping on series just for us, if that's something
Wow.
that folks are interested in.
Wow. That's wonderful, Robbie. Thank you. Thank you. Nicole, what other factors make you more susceptible to have a fall?
A lot of different things such as medications and disease process. There's different diseases that affect musculoskeletal or neurological, impairing gait, sensory deficits, impaired vision, and hard to hear, hearing impairment. All not being able to take in your environment and be aware of some of the hazards that might be out there.
Thank you. Very good to keep in mind.
Yeah, we also at Coastal Hospice have a great team of social workers that often connect families and patient and caregivers to resources through some grant monies available to certain areas, and they help with sometimes grab bars or ramps, those types of things. So other safety interventions available.
That's terrific. And it's great to know that there's many affordable prices for some of these things, and that there's some help out there for people who maybe can't afford that. Thank you both. So, importance of quality and purposeful movement. Robbie, I'm interested about this training.
Sure. So I I kind of like to call it like, all right, it's purpose-driven movement. All right. So a lot of the folks that I see sometimes, like, they've never really exercised. Maybe they've never even stepped in the gym before. Yeah, that's totally fine. The main thing is, like, I call it training, but main thing is, like, we're moving with purpose. We can, like I said before, maintain our bodies so they can keep taking care of us. We can keep taking care of other people. So to kind of break down training so that you can train more effectively is, if you want to think about it in like two areas. And then again, this is for the patient and our caregivers too. So mobility and stability. If you want to think about those two areas of our training that we want to invest some time into both of. So mobility, if you want to think about that, is like maintaining adequate ranges of motion for our joints so that we can put ourselves in a good position to stay pain-free and move powerfully. For the sake of, I would say, our, I guess, like hospice care and our patients, the main things that we want to keep mobile would be your ankles and your hips. We'll talk more about how to do that later. But basically, like, your ankles and your hips are like your key to your independence, your key to keep living the life that you want to live. So mobility, range of motion, adequate ranges of motion. All right, stability. Okay, so the definition of stability is minimizing or eliminating excessive or unwanted motion. All right, remember that term. That's going to be really important later. But stability also refers to, in layman's terms, like strength. Okay, so we have our mobility. We want to be able to put ourselves in good positions. We want to be able to move, like even things just like being able to like move your, here we go, y'all. Move your ankles in plantar and dorsiflexion, just adequate mobility so that we can avoid things like that slip fall where we shuffled our feet, stuff like that. Stability, again, minimizing excessive or unwanted motion. That's going to be really important later. All right. So after you kind of understand those two branches of training, the other part that we need to put in play, whether or not you hit the gym a lot or have never gone in there at all, one thing we can all do is improve our body mechanics. And that's like what Nicole said, like being aware of how you're moving so that we can, like, not rush, but be aware. So proper body mechanics. We'll get into that, I think, in the next couple of slides. Some balance training. So balance, really, I like to, again, refer to that as like stability training. There's a lot of other parts of that. So like the physical aspect of like strengthening your feet and your hips and your lower extremities. But there's also like a very important like neurological and cognitive component of that too. And then yes, that does say homework. So we'll get into that a little later too.
Yeah, tell me more about this homework. I'm very interested.
Sure. So, from my experience working with nurses, caregivers, and also just maturing population. So like I'm training with, well, shoot, I am training this afternoon. I have somebody in their 90s that I'm training, and they get quite, but everybody can benefit regardless of what stage of life or what level of functionality you're in. So some of the homework stuff, I have homework for that's directed for like the patients and also the caregivers, but both could do it, the drills, exercises, kind of interchangeably depending on one's functionality. So some of the homework, and if folks are interested, we can email it out. I'm not sure how well you're going to be able to see all this stuff, but so as Lauren said before, I was a barefoot balance specialist certified. So a lot of our balance comes from like the sensory feedback we get from our feet. A lot of times it's like wearing shoes and stuff, and things like chronic conditions like diabetes creates like neuropathies. So like we don't get that same sensation and feels from our feet. So I've got some very simple, effective barefoot work that folks can do too.
Great.
I've got some exercises that are also like modified. So depending on the patient, they can either do it like laying in bed, seated in a chair, some things to work on strengthening our hips, like I said before, and which we'll get into very shortly, body maintenance and like mechanics, so things to help us reinforce those good biomechanic patterns and movement patterns, so to speak.
That sounds great, Robbie. So tell us about this breathe and brace.
Oh, shoot. Yeah. All right. So I would say y'all focus up. If there's one key takeaway from like everything that I have said or will say today, this is it. This is it. Focus up. All right. So we worked with Tidal Health's. We did a weight loss and wellness program a few years ago, and I was so surprised at how many of the nurses that we trained with had back issues. And it came from, as Nicole said, transfers, like moving people, right? So the most important, I would say, like body mechanic. So this is a skill that you want to continually focus on developing and improving upon. It's breathe, brace, and I should say move. Breathe, brace, and move. So pardon me real quick, got to get a toy. All right, so brace. Your doctor refers to this as like bearing down, which is kind of gross, but it's like, it's like we're all adult. I would imagine we're all adults in here. It's like if you had to poop, but you can't. So you're really bracing. One of the most dangerous things we can do for our spine is actually suck our belly in. Like, and I'll say later, when in doubt, stick it out. You should be pushing your belly outward. So it's about creating this inter-abdominal pressure. So by flexing your abs really firm, it comes back to stability. That's core, or like spinal stability. So think of your spine as these vertebrae that move and articulate, and these intervertebral discs in between them. So when you flex and you brace, it stabilizes your spine, minimizing excessive or unwanted motion, so we can protect those intervertebral discs, right? So a really easy one to do is like if you have your gait belt, I would hope you have a gait belt. If you don't, you're talking with the right people at Coastal Hospice. So you put your gait belt on, right? I'm gonna do a really bad job of putting this on because we don't have all morning or afternoon. But you put it on, and it shows in that picture, you want to be able to put like a finger or two. And I like to put it on the side because your obliques on the side constitute more abdominal pressure than just your abs. And the main thing you want to do is push out against that belt so that you're pinching your fingers between the belt and your body. And you, as you're pushing outward into the belt, 360 degrees around you, maintaining that pressure. I'm doing it now, but you should still be able to talk, breathe. And if someone took your blood pressure, it should be kind of still normal. So it's important to brace, but it doesn't do us any good if while you're moving somebody, you have to hold your breath, right? So brace, breathe, and move. Okay.
That's good to remember. Keep breathing.
Don't
Keep breathing. I had something come through the chat box for you, Robbie, and it says, what about patients who have limited mobility and maybe can't stand up? And I kind of remember earlier you mentioned in some of your homework that we can still do things with those patients.
Yeah. So in the homework, I've got some descriptions and pictures. So I think it's still really, really important. I understand with like hospice care, we're talking about end of life care a lot of times. So there are some really important things. So for example, I've few of the drills for the feet, which would be really helpful, say, especially if the person is still, well, shoot, even if the person is bedridden, it's still really important to have their lower extremities and feet move so we avoid things like blood clots. But also if they can stand, this will help them avoid falls, improve their balance as well. So one of the first exercises, simple like toe wiggles or trying to like spread your toes. If you can't spread your toes, you can always like take a tube sock or something and wave it in between. So when you're just chilling, watching TV, you get space in your toes. Or like ladies, if you still do like your like pedicure stuff, you can put that stuff in between your toes and you get space between your toes. We've got things like ankle pumps. I know it's not very sexy and highly underrated, but your ability to like heel toe walk can help you eliminate a lot of falls. And some of those exercises are even ones that they can just do like straight up laying down, like even the mobility part of like laying on your back, stretching out, opening your wings, so you can stretch out your chest and your anterior delts, biceps, help out full breath, good posture. It's related to balance as well. So I'd say like even when folks have impaired functionality, it's still really important to get them, as I said before, like moving with purpose.
That's great. So there's still ways, even for those of us who may have some mobility issues, there's still ways that we can get them moving. That's wonderful. Thank you for sharing. Thank you. So Hinge, tell me about Hinge.
All right. So building off of your breathe, brace, and move. Okay. The other things it said previously, that caregivers, CNAs like have a higher risk of injury, and most of those injuries happen to the spine, especially lumbar, lower back. So it's important that we learn how to use your hips right. Okay. Again, we're all adults. I hate to just be very frankly here. The mechanic pattern here is basically an air hump. Why? Because if you look at how we're made, our body, we have very small musculature in our lumbar. We have larger musculature in our glutes, in our thighs, around our hips. So we should learn how to use our hips instead of our lower back. So with this, what we first do is remember a foundation, brace, right? And then I refer to it like the hinge as like, you want to do this when it's like a high pickup. So something that's, sorry for tilting the camera, something that's like knee height or higher. So the important thing is instead of extending or straightening with your upper back and lower back, it's brace, stabilizes the spine, and like it says on the slide, when in doubt, stick your butt out. Okay, so we're breathing, we're bracing, say we're getting ready to make a quick little transfer. So you're bracing, when in doubt, you stick your butt out and feel some of your weight shift to the back half of your feet. If you're at home and you want to get up off the chair and move with me, I'll totally do it right now. So brace, when in doubt, we're sticking it out. Okay, and then on the ascent, it's like I said before, it's like an air hump. It's a thrust and it's an extension of your hips. So you get these large butt muscles extending your body instead of these small lumbar muscles. All right, so you can practice that like at home. You're like getting something from a drawer or like the dishes. So if you want to think of like, I don't know if anyone's seen that movie Legally Blonde, where it's like bend and snap, right? So brace and learn how to stick your butt out and thrust it forward.
So when in doubt, stick it out. We can't forget that. We'll remember that.
Yeah, I will brainwash you, buddy.
And how about squats? I see that's up next.
Awesome. All right. So the pictures on there are an extreme exaggeration, but it helps illustrate the mechanical patterns that we're trying to reinforce here. So building off of, again, that foundational body movement pattern of breathing and bracing. When in doubt, stick it out. So I refer to this one, this is like a low pickup, anything that's kind of like below the knee or lower. All right. So this is also really important for anything. I don't care if you're about to pick up a piece of laundry or if you're about to pick up something that, or if you're gonna maybe help somebody. The important thing is, again, breathe and brace. All right, and then, oh shoot, I'm gonna have to back y'all up just a little bit more. Need a full body shot. All right. So again, if you're at home, you want to practice, this is awesome. Y'all, I have folks in their 80s that squat beautifully.
Wow.
Yeah, better than athletes I've trained. So it's possible you can do this. So breathe and brace. When in doubt, stick it out. So I say, open up your, even from when in doubt, stick it out, starts with your toes. So like rotate your toes outwards a little bit, a little duck footed. Or externally rotate your hips for better knee alignment so you can avoid knee issues. So breathe and brace. When in doubt, stick it out. So like your knees and your butt. And then kind of sink down when you feel the weight right down to the arch of your feet. So like not too much to your toes. We didn't stick it out enough. Not too much to our heels. We'll stick it out too far. But breathe, brace, whatever we have to do down here. And it's like a press with your thighs and a thrust with those hips again. So just try and remember, when in doubt, stick things out, breathe and brace, and then always on the way up, the thrust is a must, so I can save your lower back, keep you going.
Great tips, Robbie. Gives us a great visual. Thank you so much. I have a question from the chat box that Nicole, I'm going to direct this to you. What should I do? Rachel Simmons asked, what should I do in the unfortunate event of my loved one falling? That's a great question, Rachel.
It truly is. And we educate our families and caregivers to always notify Coastal Hospice when there is a fall, so we can certainly respond with a nurse to come out and assess for any injuries. And then, of course, we do reassess the fall risk, as I talked about earlier. Some falls may result in a need for us to call EMS for lift assist, or in the event that there is a suspected injury, fracture, or an apparent injury, head injury, it may require transfer to the emergency department for further evaluation.
Great to know. Thank you. And Nicole, I know Coastal Hospice has many services to help people stay in their homes. I know about, of course, the Compass program that people can use prior to needing hospice. Will you tell us more about that?
Yeah, we talked about that a little bit earlier. It is a free community-based program where we provide resources to folks who have serious injury but might not quite be ready or appropriate or eligible for hospice services. And things that you'll see are connections with food, meals, whether it's Meals on Wheels or movable piece, different depending on the community and what resources, building wheelchair ramps, or volunteer visits for companionship, or to help with safety measures in the home and looking at that, spiritual care. We have veterans that do visits, and also just providing that socialization and assisting with transportation, getting groceries sometimes, little things like that. And then we just sort of walk along with them. And if they need further, more intense services for us, then it's through our organization.
Great. Again, this is another program that is free to people in the community and that people can utilize when they have serious illness. That's great. How about when a person does need to have hospice services? Who's a part of that team that can help them stay safe in their homes?
We have a great interdisciplinary team, and it consists of our physician, nursing, home health assistants, nursing assistants. We have medical social workers, we have spiritual care, and our wonderful volunteer department. We also have physical and occupational and speech therapy available. They do some limited evaluation for safety in different areas. And for instance, care of the bed-bound patient as a patient would decline or have changes. And there's caregivers in the home that are not familiar with that. And that does also incorporate a lot of safe body mechanics and such with caregiving.
That's great. Nicole, tell us more about what kind of safety training there is for caregivers. What safety training does hospice provide?
Well, for our caregivers, we do an annual skills fair, at which time they review. Our physical therapist provides training on body mechanics, sort of that foundation to core body strengthening, and reminding us all to slow down, take a look at our environment, focus on the transfer or activity that's about to occur prior to rushing into it. So many times these falls are, they're accidents, and they happen when we're hurried or rushed sometimes. And it's a matter of just taking our time, slowing down. For our patients and families, like I said, we do complete a fall risk assessment on admission, and then with any changes, whether that be a change in care setting or a change in patient status, we reassess those needs. We provide education to the caregivers, and again, limited physical therapy evaluation for training for different transfers and safety.
Great. And I know, like you said before, things as simple as hearing aids and glasses, those things that can help people to be able to hear and see. And those are important things to stay safe.
Right. Keeping those frequently used items within reach and assessing needs to make sure that our patients aren't in pain and unable to express it and restless because of that, or a toileting need. So yeah, just sort of anticipating their needs and meeting them as best we can.
Wonderful. So I have a quote that I wanted to read you both and to get what thoughts that you have. A good death to me is where their needs are met and they're relatively pain and symptom free. I want to know what thoughts this elicits for the both of you. Robbie, let's start with you.
Sure. So I kind of pulled bits and pieces of this from some of my personal interactions with folks. So I've really enjoyed working with mature populations, the 15 older folks. It's definitely given me a better insight on life, puts more value and weight into it. I feel like it's made me a better husband, but also better at like helping to build relationships with people and knowing like that's the really important thing here. So seeing people come and go, we've got in our office, we have a bulletin board that we post up obits of our gym members and clients. We always remember, I can take value in every moment you get with people. And there really is, like, I understand, like, we're talking about like the final chapter of someone's life here. And it matters. And we really want to make sure these final pages are as good as possible. So things like we said in the beginning, improving communications. So that's why I've really personally enjoyed the training aspect, because as we're doing things, even like those little things like toe wiggles and ankle pumps and leg lifts, things like that, that's a good springboard and platform for me to like have a conversation and chat with somebody. And so it really does matter that, like, we communicate effectively, that whatever that person's needs are at this transition point in their life are met, that the folks around them are educated and understand what to do to help manage that person's like symptoms or pain as best as possible. So it's an eventuality that we all have to deal with, and I think there are definitely good and better ways about helping and seeing folks through this transition phase of our lives.
Absolutely. I love what you said about using movement to build rapport with people and to build relationships with them. That's a wonderful way that people can stay moving and healthy, but also to build relationships, especially in that end of life when you need someone for you. You need a friend.
Definitely.
Thank you, Robbie. How about you, Nicole?
Well, I think we say a lot of times with Coastal Hospice, we're not about death so much, but we're about living. And our philosophy is built largely around promoting comfort and comfort care. Obviously, I alluded in the past about anticipating and meeting needs, whether it be, hydration or food, toileting, pain management, and just creating and promoting that calm, soothing environment. The connection, the touch, the soothing and calming benefits of some of the exercises that Robbie has shared and encouraged. It just is how our interdisciplinary team shoots to support the patients and families.
That's beautiful, Nicole. I love the concentration on quality of life and taking care of patients, making sure their needs are met and that they're comfortable. That's great. Thank you. We're almost out of time. This was so helpful and such wonderful information. We'll be emailing you all the attendees with the info that Robbie shared. But one last thing before we wrap up, I want to hear from both of you. If there's just one piece of information that we should take with us today, what would that be? Let's start with you, Robbie.
Breathe, brace, and move. Brace. And when in doubt, stick it out. I really hope that we've been of help. I really appreciate, again, the time. I feel honored to be a part of this webinar. So thank you.
Thank you so much, Robbie. Thank you for being here. We're honored that you joined us. Thank you. Nicole, how about you? What piece of information would you like us to take with us?
Just to know that fall safety and prevention is for everyone, and sort of focus and look at the angle of self-care. You have to really take care of yourself as a caregiver in efforts to be able to properly and safely take care of your loved one or patient. So just promoting that.
Thank you. Thank you so much. Thank you again, both, for sharing your expertise. I can't thank you enough for being here with me today. To wrap it up, I'm going to send it back over to Lauren King.
Thank you to all of our panelists, Robbie Chin and Nicole Moore, for helping us learn more about staying safe. And thank you to everyone who has joined us today. We hope the information was useful for you. We have a great list of references prepared that we will send to all attendees. To wrap things up, we ask that you take a couple of minutes to fill out this short survey. It is only 5 simple questions. Your feedback will help us bring relevant programs to you, your practice, and those you care for. When you click Leave the Meeting, you will receive a survey from Zoom. This was a presentation from the Coastal Caregiver Academy, supporting and empowering caregivers in our community. At Coastal Hospice, we are here for you, and you can call us at any time on the number on your screen. Thank you once again for joining us. I am Lauren King. Have a wonderful rest of your day.